good morning to all of you. I have not structured my talk, but as Dr. Agarwal told you that I will speak 5 minutes each on kidney disease and then medical aspects and legal aspects. Kidney disease, the specialty which deals with kidney disease is called nephrology. And this specialty is only about 50-year-old. Most of the knowledge regarding kidney disease is there for last 50 years. And as Dr. Vaid told that a lot of research has been made during the last half century. But unfortunately, when we know that, still we think that a lot of is known to us at molecular basis. But I strongly agree with him, I do agree with him, that at the end of the day, even as a doctor, we know that probably we don't know much about this human body, which has been designed without God actually. And a lot has been learned about kidney diseases regarding causes, how do they behave, that is called pathophysiology and treatment over last 50 years. And we have learned that what are the important causes of kidney diseases. And let me tell you that here, the diabetes mellitus and hypertension, they are two major diseases which accounts for about 65% of kidney diseases patients or kidney failure, and they are the very major killer for as far as heart disease are concerned. In fact, kidney and heart, they go together, Whosoever has got kidney disease, heart will be invariably involved to some extent. Howsoever minute kidney disease may be there, but it is a major risk factor for heart disease. And that's very important. It's very important to prevent kidney disease so that indirectly you prevent heart disease also, as Dr. K. Agarwal is going to speak a little later. So we learned that it is possible to prevent kidney disease, and prevention is the requirement of our, or the need of our. We know that when after spending $1 million also, still it is not possible to get the effective cure or effective treatment for these diseases. So it is better to prevent these diseases. And I think the slogan of this century will be on prevention of diseases only. Last century we devoted on understanding the diseases, etiology, pathophysiology. But this century should be totally devoted toward the prevention of diseases. How can we prevent them, and how can we make this world better, And you know that I will not like to go, but at least understand that diabetes and mellitus, if there are two major causes, then their treatment is required at very early stages. There is no point of having their treatment. At that time, we cannot achieve much when already heart and kidney have been affected by these diseases. They have to treat it at silent stage, when they do not cause any symptom and sign in the body. They have to detect it early, so that, and then we have to provide education, because these diseases are taking place at prime of age, when people are in 30s and 40s, when they are doing their business, when they are at the peak of their career. And since they are not going to have a symptom and sign, they are not causing any problem to the person, but they are silently killing all the organs, not only kidney, they are killing heart, brain, and other organs as well, and person doesn't know about that. So it is very important that we must have a very strong preventive program for that. And you will be glad to know that WHO has already included chronic kidney disease also in the preventive program in 2011. And all over the world, every country will take measure regarding this, So that is as far as prevention is concerned. Other diseases which are very prevalent in this part of country, in northern India, that is stone disease. That is also fairly common, especially more common in Delhi and J&K. These are the two parts where these diseases are very common. So they should be also treated at the earliest, and kidney disease can be totally preventable, So that is regarding prevention, and I think because these two diseases are common both for heart disease as well as kidney disease, and some lifestyle diseases are common for everything, so that some part Dr. Ashok has already covered, and most of these parts are covered very nicely in the preventive programs on television and newspapers, Next part is that what is the treatment available for once the disease had taken place. Let us say somebody has got kidney disease, and nowadays it is called very commonly term which has been coined for last 10 years by International Society of Nephrology, that is called CKD, chronic kidney disease. That is just to be replaced word renal, it was called chronic renal failure, but you replace this term by kidney because kidney is well known to common people also. And the evolution of chronic kidney disease through 5 stages, and it is a stage 5, and the out of stage 5 also then will be of stage 5D, that is in dialysis dependent, when any more drugs cannot take care of the body, that is where then dialysis is required. Before that is a long journey, so one should not be afraid. If somebody diagnosed a case of early kidney failure, it is still possible to have years of useful life if you follow very properly treatment. And for that you do not require necessarily nephrologists. In this country, unfortunately, right now there are only about 1,000 nephrologists, and they cannot take care even of stage 5D disease, CKD. But all family physicians, internists, with little bit knowledge of kidney disease, they can help in prolonging and giving useful life to patients suffering from CKD, and that is very important. Now we have tried to prolong the life of CKD patient, then still some patients will be landing now in CKD 5, where you require dialysis or transplantation. And a lot of research had taken over last 50 years in dialysis also. Dialysis was started as a therapy in early 60s actually, to be very precise in 61. And as you see in any technology, miniaturing had taken place here, and probably we are very soon, in a year or so, we are going to have very small portable machines which can be tagged to the body, and person can be mobile all the time and he can hemodialysis. And this then similarly another therapy which is called peritoneal dialysis, or popularly known as water dialysis, where fluid is put in the abdominal cavity and it drained after some time, and abdominal cavity also acts as a third kidney. That is also popular for last 20 years, and in fact with a little bit of involvement of government of India, this can become really a very popular and practical therapy for patient of CKD 5D in this country. And this is also fairly prevalent, but since it is very expensive right now, there are only about few patients though who can afford this treatment also. And of course, as things stand today, the kidney transplantation is the final answer, because organ has to be replaced by organ. If you want to replace 100% malfunctioning the body, then you have to provide kidney, and that is kidney transplantation. So dialysis doesn't provide 100% treatment, it hardly provides about 20 to 30% of, and it corrects only 20 to 30% of abnormality which are produced as a result of kidney failure. But still it can give many years of useful life to the people if they can really afford it, So dialysis is also expensive therapy, and it is not a ideal replacement for kidney failure. Then comes transplantation, and the transplantation does really provide quality life, but is again not without side effect. Patient have to stay throughout life on drugs in order to prevent rejection of the grafted kidney. And those drugs are not without side effects. They are just like cancer drugs, that a lot of side effects are there. And these people are more prone to cancers and infection because of that. A lot of research is taking place in that direction also, so that better drugs are available, so that we can give only selective immunosuppression. But we are still far away from that, Ideal will be that if we can have regeneration of our own kidneys, and that is where some stem cell therapy or something will be there in future, and we are quite hopeful that in near future it will be possible to regenerate our own kidney, And at that time, probably we may say that all transplant or everything we were doing there were all rubbish. But that is still not a reality. But I am quite hopeful that this will be reality in this decade only. That we will be able to regenerate kidney, if not fully, then partially, so that people can continue without dialysis or without transplantation. So that is where, as far as treatment is concerned. And the second aspect, where Dr. Kabirwal, what do you want to expect?
Interaction on ethics.
Ethics,
Specifically organ transplant.
Yeah, ethics are related to only organ transplantation. And you must have heard about kidney bazaars in Chennai, Bombay, before the this Human Organ Transplant Act was in picture, which has been enacted by the Parliament in 1994. And let me tell you that after this act is there we can't accept organs from unrelated donors as far as living persons are concerned. And only the related ones, that is defined by the law, and those are like brothers, sisters, parents, husband, wife, son, daughter, and emotionally related people also can donate kidneys, provided those relationships are approved by the blood test. So that is the part that there is very stringent rules, and that is just to check unethical practice. That was one aspect of the law, and more or less it is being followed in the whole country. And I must say that to the tune of 90%, unethical practice in the kidney transplantation or organ transplantations are not there, but still about 10% practices here and there, they are existing actually. The other aspects of this other aspect or the other aim of this transplant act, which is a major aim, was to promote disease organ transplant. That once somebody who is brain dead, we can take a lot of organs from them. You will hear a lot in the newspapers. But that is where this law has really not come up to our expectation. It has opened the door, but it requires public awareness. Nobody is ready to donate the organ today, even after the brain death. Family do not agree. And that is where this crowd and the organizations, lot of non-government organizations, the government, printed media, electronic media, they can play a lot of role. And that is where I think that the need of that we all get involved, so that we can at least shorten the gap of supply and demand of kidneys. I must tell you that nearly 2 lakhs of new patients in this country, that is also underestimation. They are added every year. Those who are suffering from CKD 5 stage D, requiring dialysis and transplantation. Not more than 10 to 15% of these people are able to get some sort of therapy, dialysis or transplantation. Dialysis is very inadequate. Transplantation, only about 4,000 people are transplanted every year in this country, which is a very small number. So that dialysis, those who are getting about 37 patients are on dialysis at a given time right now at present, and they are not getting adequate dialysis because dialysis is very expensive treatment, and most of those people, they are not able to afford adequate dialysis. They are just dragging their life. And so that is as far as ethics are concerned. That is as far as legal part is concerned. And the third. Thank you.